the topic teratology. Okay? Anyway, all of the things written in this lecture are actually also written in your book. Again, our book is O.B. Williams, the 26th edition. That's the latest. Okay? So this is found, the topic is found at chapter 8 of our new obstetric William book. Okay? So when you say teratology, we're actually talking about the birth defect, and this is defined as actually a major deviation from normal morphological or morphological function of a particular body part. Okay, so most of the time, if there will be birth defects, the most common question that we ask the patient is, were you exposed to some medications during the time that you were on your first 3 months of pregnancy? Yun yung lagi kasi nating tinatanong. May nainom po ba kayong gamot? Kasi sometimes the birth defects that can already be visualized by using an ultrasound, no? Since ultrasound can be done right and left. Okay? So some of the birth defects can be diagnosed as early as around siguro mga 18 or 24 weeks during the congenital abnormality scan of a particular patient, or as early as the first trimester if it's really evident na. Okay? Now, these are the common birth defects that we usually see, right? The cleft lip, no? Misconception kasi ng mga pasyente, like for example, they got pregnant, then nadapa sila kasi nisip nila the baby is usually on a thumb suck position kaya nagkakaroon ng cleft lip. Little do they know that the reason for the cleft lip is actually most of the time, if you try to read the book, it's genetic. Okay? So these are other abnormalities. Okay? Now, in the Philippines, this is actually the latest, no, released by the World Health Organization. According to the published data by the WHO last 2020 Congress, anomalies or deaths in the Philippines reach around 8.051% of the total deaths in the country, in our country. No? So that's how high the birth defect causing mortality in the Philippines. Okay. Now, as compared to the United States, actually, the birth defects released by the FDA last 2018, most of the birth defects are actually unknown. Minsan kasi nagkakaroon na lang. And then, when they try to trace where did it came from, minsan or most of the time, hindi nila alam. Or wala naman talaga silang nainom or hindi naman talaga sila na-expose. Okay? So studies have shown, as compared to the United States, although in the Philippines, wala pa kasi talagang data kung alin-alin yung nagkakos ng 8.051% of the birth defects. But in the United States, last 2018, it has been said or it has been studied that most of the etiologies of birth defects are actually unknown. Okay? Now, moving on, teratology, as we all know, is a study of the birth defects and their etiology, which is actually derived from a Greek word known as teratos or monster. Okay? So, teratogen is any agent that acts during the embryonic or fetal development that produces a permanent alteration in the form or function. So, it may be an environmental exposure. So, currently, the recognized teratogens sometimes are usually chemicals, viruses, chemicals including the medications or drugs that they were that the patient took, viruses, again, environmental agents, some of the physical factors, and usually drugs. Okay. So agents that produce a structural abnormality, we call it teratogen as a whole. So there are other two nomenclatures that are used aside from teratogen. One is hadigen, after the gods of Hades. This is an agent that interferes with the normal maturation and function of the organ. And another is tropogen. When you say tropogen, from the word itself, tropo, meaning growth, right? So this is an agent that alters growth. But as a whole, hindi naman kasi sila particular dun sa word na hadigen or tropogen. So what they usually tell if there will be exposure is, it's called as teratogen as a whole. Okay? So these are actually the guidelines written in the book. This is found in the book, no? Nakalagay sa specific page at saka nakatabulate siya. These are guidelines released by Shepard in 1994. Now, these are the essential criteria for you to determine the teratogenicity. Okay, I will not anymore read isa-isa because this is actually self-explanatory. So when you're talking about essential criterias as a whole, you have two criterias. We have an essential criteria, and these are the essential criteria. And you also have um, ancillary criteria. Okay? So criteria for determination of teratogenicity. Okay? The abnormality should be or has been completely characterized. Ibig sabihin, before labeling it as a teratogenic drug or medication or an environmental exposure, it should have been completely studied. No? And then the agent must actually, again, cross the placenta, because if it will not cross the placenta, then definitely there will be no structural abnormalities. And what is important when you're talking about teratogenicity, no, is when the exposure occurred. Okay, so gestation is usually divided. Sorry. Sorry for that. So teratogen is usually divided into three periods. First is the pre-implantation period. You have the embryonic period, and then you have the fetal period. When you say pre-implantation period, this spans 2 weeks from the fertilization, and it is said to be all or none period. Bakit all or none period? Because all, if there will be exposure and damage occurs in large number of cells, then there can be a death of embryo, no? Or none at all. Kaya all or none. When you say none naman, sometimes when injury happens, few cells lang. So most of the time after that, there will be compensation and normal development. Kaya ang tawag sa kanya, if ever that patient is exposed during the pre-implantation period, we call it all or none law. Either madamage lahat or madamage ang konti, and then nothing will happen at all. Okay? But the most crucial when you're talking about exposure is the embryonic period. And this spans 2 second week through the 8th week, no, following conception. Because this actually encompasses organogenesis, and this is the most crucial with regards to structural malformation. Kaya nga ang laging sinasabi, first 3 months of pregnancy is the most crucial because it actually spans the embryonic period. Okay? So this illustrates the critical developmental period for each organ. If you try to look at it, first, most of the structural abnormalities that can happen in the face, cardiac abnormalities, and the brain usually happens in the first 3 months of pregnancy, specifically during that embryonic quote-unquote period. Okay? And lastly, you have the fetal period. Okay? When you say fetal period, no, during fetal period, certain organs remain actually, even if the embryonic period already, we already passed the embryonic period, some of the organs during the fetal period usually still remains vulnerable. Okay? So one of it is actually the brain, which is susceptible throughout the pregnancy to environmental influences such as alcohol exposure. So even if the patient already passed, or the pregnant patient already passed the embryonic period and most of the organs are already developed, then once she's inside the fetal period, that is 9 weeks after, no? Kanina, 2 to 8 weeks, and then fetal period is 9 weeks. Still, there are not a lot, no? Some of the organs that are still vulnerable in cases wherein the patient will be exposed, pwede pa rin siyang maging affected. Okay? So, this picture, again, just shows us this is the pre-implantation period, the all or none law. And then this is the embryonic period. So actually, after 2 weeks to the 8th week. So if you try to look at it, most of the organs are actually developed during the embryonic period. That's why it has been said that this period is the most crucial. Okay? But as the months go by or the age of gestation goes by, most of the time, it's actually the brain that is vulnerable na. Kasi all of the organs are already developed, and this time, the fetal period, pinapalaki na lang sila. Okay? So these are examples of your, example of a patient who was affected with a teratogen during the time that she is still a fetal or during fetal period and more likely embryonic period. Okay. Now, when you say exposure to teratogen, one of the most important thing that you have to do for a patient is actually counseling. You have to tell them the risk of the risk or what can happen after delivery, no? Since they were exposed to an agent that can cause structural abnormality. So questions, we usually ask questions regarding the medications that they took, when or what age of gestation did they took it, no? Some of the patients or some of the pregnant patients kasi they use illicit drugs. So you have to also extract that. Although just in case a patient is tag nito, the patient is using illicit drugs, most of the time hindi naman nila sasabihin sa inyo yan eh. So you have to have a keen observation during the prenatal checkup. Okay? So exposure to any teratogenic drugs, counseling is very necessary. Although sometimes, even if, for example, the drugs that they were exposed is highly teratogenic, counseling in the Philippines, no, is counseling in the form of for them to be prepared what to expect after delivery. Because in the Philippines, we have no option for an abortion. Okay, kahit na highly teratogenic yan, definitely maraming magiging congenital abnormalities. We don't have any option for abortion. Not unlike in the United States or other countries, counseling includes actually the option for an abortion. But in the Philippines, wala kasi yun. No, we just try to prepare the family and the patient, the pregnant patient, on what to expect after delivery. Okay? Now, one of the most common abnormalities that happens is actually in cases wherein there is a disruption of folic acid metabolism. That's why in your prenatal topic, not prenatal, a prenatal topic, no, we usually, I think kasama din yan sa maternal adaptation. No, one of the vitamins or supplements that we usually give is to give the patient folic acid. And ideally, it should be taken preconceptionally bago magbuntis yung mommy. Although, a lot of pregnant patients just visits the clinic during the time that they knew that they're pregnant na, then that's the time that they only start the folic acid. But again, for the female students around, folic acid should be taken preconceptionally so that the maximum effect can be achieved. Okay. So disruption of the folic acid metabolism is one of the most commonly encountered abnormalities. No? This includes yung mga abnormalities na naririnig niyo, neural tube defect, cardiac defect, cleft lip and palate, no? And sometimes even Down syndrome. No? That can happen. Okay. So folic acid is actually essential for the production of your methionine, which is required for methylation reaction and thus production of protein and lipids and myelin. That's why it is important for normal meiosis and mitosis. So as I have mentioned a while ago, abnormalities in folic acid metabolism, no? You have your neural tube defect, the cardiac defect, cleft lip and palate, and even, again, your Down syndrome. There are actually, or some of them are thought to arise in the disturbance in your folic acid metabolism. Okay? So one of the common medications that actually disrupts the folic acid metabolism are the ones that are used as anti-epileptic drugs, and these are the following: the hydantoin, the carbamazepine, no, the valproic acid, and the phenobarbital. These actually all impair the folate absorption, and actually it acts as an antagonist, and they can lead to a decrease in preconceptional folate level in the women. No? So, sino ba yung mga binibigyan nito? They are actually anticonvulsants. So, mostly they are given to patients who are epileptic. No? Now, what happens is that whenever a patient is given this anticonvulsant drugs, they are actually metabolized, no, to microsomes to arginine oxide and epoxide. And this oxidative intermediate normally are detoxified, no, by your cytoplasmic epoxide reductase. But because of fetal epoxide reductase activity, this weak oxidative intermediate accumulates in the fetal tissues, and these free oxide radicals have carcinogenic and mutagenic effect and other fetal toxic effect. Okay. Now, speaking about teratogenic exposure, it's not just the women or the maternal side that can actually cause a structural defect or exposure in the maternal side. We also have to check on the paternal exposure. Nowadays, paternal exposure to teratogenic medications or um, teratogenic drugs are actually of study, no? Because this exposure, no, sa paternal side increases or can increase the risk of adverse fetal outcome. Okay? So, these are the reason, no, introduction of gene mutation or chromosomal abnormality in the sperm that can cause structural abnormalities in the fetus, or sometimes, no, they study that during intercourse, a drug in the seminal fluid could directly contact the fetus. Not actually in contact with the fetus because the fetus has amniotic fluid barrier, right? But then again, the seminal fluid can go inside and then that can contain some of the drugs that can affect the fetus inside, no? And paternal germ exposure to drugs or environmental agents that may alter gene expression. Okay? So again, not just the maternal side, fetal side, no? The paternal side should also be investigated. These are actually some of the studies that showed that even if the maternal side doesn't have any exposure, once the paternal side or the father of the fetus has an exposure to some of that drugs, that actually can have, or the fetus can have actually structural abnormalities. Now, these are written, actually, the studies are written in the book. Okay. Now, what are this category A to category X? These are actually FDA-developed letter classification system to provide therapeutic guidance for prescribing the medication in pregnancy. So definitely, if you will be given, if the patient is pregnant, most of the medications that we give are that of category A. Okay? Kasi as you try to look at it, pababa ng pababa, these are actually categories, no? That depends on the statement regarding the available evidence from human or animal studies with regards to embryonic fetal risk. So as the letter increases, no, nagkakaroon ka na ng tag nito, ng mga precautions. Okay? But again, if we're talking about most of the medications in the pregnant patients that are given, it should be or it should belong to category A or category B. Okay? But unfortunately, no, the infos category A to category X, no, regarding the medication risk of this FDA classification system was often incomplete and led to an over-reliance to the category definition. That's why to address these deficiencies, the previous deficiencies in the category A, B, C, D, and X, FDA usually released this new labeling requirement that created and went into effect last 2015. And this label provides framework to aid prescribing decisions, no, by more clearly communicating the risk and benefits. So pag tinignan niyo siya, very specific na. Not unlike dito. Okay, category lang yung nilalagay. And then pag nilagay doon category B, hahanapin mo pa anong ibig sabihin ng category B. Okay? Not unlike the FDA classification system or labeling that they did, nakalagay na siya. Is it safe for pregnancy, safe for patients who are breastfeeding, or male or female reproductive potentials, or infertility or fertility. Okay? So, these are the new FDA labeling requirement. Okay? Now, let's go. Sorry if I, medyo mabilis kasi napakahaba ng slides natin. So, I will just emphasize the most important, okay? So, let's go to the selected known or selected teratogenic or phytotoxic agent. So, ethyl alcohol, this is one of the most potent teratogens, which is known. But then again, as the studies have shown that there's no established safe threshold, no, dose for alcohol use during pregnancy, even what kind of alcohol, walang sinabi. Okay? But then again, current data indicates that women at higher risk to have affected children, those with chronically ingest large quantities and those with who engage in binge drinking. Okay? So women ingesting 8 or more drinks in a day throughout pregnancy have 30 to 50% risk. That's why early cessation may ameliorate some of the effects. But then again, if you will ask me or ask the other member of the department, ano po ba or gaano kadami po ba para magkaroon ng effect? No? Wala talagang specific na sinabi. Okay? So this is the criteria for prenatal alcohol exposure. No? So once one or more is required, for you to be able to say that the patient is exposed to alcohol. Like for example, more than 6 drinks per week or more than 2 per week. Kung anong klaseng drink, hard ba siya or just a plain and simple beer ba siya? Wala kasi talagang sinabi. And pag sinabing drink kasi, usually they pertain to glass, not actually bottles. But what kind of drink, wala talagang specified. Okay? And this is actually the criteria for fetal alcohol syndrome. So when you say fetal alcohol syndrome, this criteria all should be met. Okay? And what are the fetal alcohol syndrome that can happen to patient? They can have dysmorphic facial features, They can have growth impairment, abnormal brain growth, and morphogenesis, and neurobehavioral impairment. So this is an example. This is actually also can be seen in the book. This is an example of a patient or a fetus who was wherein the mother was exposed sa alcohol during pinagbubuntis pa siya. Okay? Now, aside from that, you also have alcohol-related birth defects. So, if not that alcohol syndrome, fetal alcohol syndrome, some actually, hindi naman lahat, kasi di ba nakalagay doon, dapat all should have been met. But sometimes, alcohol-related birth defects lang. So, it can affect the cardiac, skeletal, renal, eyes, or the ears. So, these are the alcohol quote-unquote related birth defects. Okay? Next medication is the anti-epileptic medications. This was already discussed to you a while ago, The anti-epileptic medications that we use, the phenobarbital, the valproic acid, okay? So, it has been emphasized that no anticonvulsant drugs are considered to be truly safe in pregnancy because, again, the risk for malformation increases as depending on the drug that was used or that was given, okay? So the most common is phenytoin, So when you say phenytoin, you have Hydantoin syndrome, you can read that in the book. What happens to the fetus exposed is they will be upper facial feature abnormalities. You have upturned nose, yung parang nakaganon, Mid facial hypoplasia, long upper lip, and thin vermilion border. Okay? Next is your valproic acid, So in valproic acid, patients exposed to valproic acid, this confers the highest risk. It has been said that 4% in patients who are exposed in valproic acid will develop or possibly can develop neural tube defect. And school children, the studies have shown that in the school children, may low IQ. With prior utero exposure to valproic acid has significantly lower intelligence quotient. So valproic acid is a little more teratogenic than your phenobarbital. Okay? Next medication that is known to be teratogenic is ACE inhibitor. ACE inhibitor, kailan ba yung ginagamit? These are actually the hypertensive. Yung mga pril, enalapril, captopril, and your lisinopril. And exposure to ACE inhibitors, usually the effect is in the kidneys. So anomalies results from prolonged fetal hypotension and hyperperfusion, renal ischemia, renal tubular dysgenesis, anuria oligohydramnios, and lung and limb abnormalities. So ACE inhibitor, ang target niya in the fetus is actually the lungs. The kidneys. Okay? Next is antifungal. No? Antifungal, the most common that we usually use is fluconazole. Fluconazole is an oral antifungal agent that we give to patients. Example is kapag nagkakaroon sila ng vaginal candidiasis. Okay? So in fluconazole, what happens to the fetus exposed, no? Usually, you need a high dose exposure. Hindi naman yung kapag binigyan mo siya, nagkakaroon na agad. Okay? So, at least 400 to 800 milligrams per day. And what happens to the fetus exposed, they can have Antley-Bixler syndrome, no? Skull abnormalities, cleft palate, humeral radial fusion, and other abnormalities. So, this is how it looks like, the Antley-Bixler syndrome. Okay? Next drug that is commonly used in pregnancies are the following: the antiemetics, no, para hindi magsuka, antihistamine. These are the anti-allergy, antimicrobial or antibiotic, no, antacid kapag sinisikmura, analgesic, pain reliever, antihypertensive, and tranquilizers. Okay. Now, anti-inflammatory agents, the NSAIDs, if you can remember in your pharmacology, this is actually some of the NSAIDs that we usually give to patients. Okay? One of the most common is aspirin. Aspirin is usually given in pregnant patients, and this is safely given to pregnant patient, no, yung aspirin. As a whole, if you're talking about NSAID, the mode of action is it inhibits prostaglandin synthesis. And I know the mode of action is not anymore new to you because this was already discussed, I think, also in your biochemistry. Okay. So first trimester exposure, there are no reported birth defects. But pregnant women more than 20% exposed to NSAIDs, age of gestation should avoid na because again, there are some of the teratogenic effects that happens na. And if needed more than 48 hours, consider amniotic fluid evaluation by ultrasound. This is again because some of the NSAIDs like indomethacin is actually given on the third trimester na. Okay? Now, speaking about NSAIDs, aspirin is actually given for patients who are at high risk. No? We usually start giving aspirin to pregnant patients at 12 weeks age of gestation. And the dose that is given is around 80 milligrams because that is the most commonly or available preparation in the market. So, aspirin can be safely given. Okay? Kasi baka mamaya may magtanong ng kapitbahay sa inyo, I was given aspirin. Tapos kaka-lecture lang kanina na teratogenic drug pala siya. Okay? So among the anti-inflammatory drug, aspirin is actually or can be actually safely given to pregnant patient. But the dose is actually less than 100 milligrams a day. Although some of the perinatologists, they give aspirin as high as 160 milligrams per day because it actually improves the uteroplacental blood vessel flow. Okay. So aspirin can be safely given to patients. Okay. Next, anti-inflammatory drug is indomethacin. This is what I am telling you because sometimes NSAIDs are given on the third trimester. And if they do so, it actually constricts the fetal ductus arteriosus and can cause pulmonary hypertension. Okay. So, kailan ba ginagamit yung indomethacin? This indomethacin is an NSAID that is usually used as tocolytic, not usually. Kasi there are other tocolytic agents or pangpatanggal ng contractions during preterm labor that can be used. But sometimes or in other countries, they use indomethacin as tocolytic. And if they use it on the third trimester, it actually constrict the fetal ductus arteriosus and can create pulmonary hypertension. Okay. So aside from those, no, when you're talking about antimicrobial or antibiotic therapy, there are actually medications or antibiotics that can be safely given to pregnant patient. But dun sa category kanina, if you can still remember, your A and B, no? A and B is actually or can safely be given to pregnant patient, but antibiotics doesn't belong to category A. They are already they belong to category B na. Okay, but then even on category B, they can still safely be given to pregnant patient, and these are the following. Okay, the penicillin or family of the penicillin group, they are category B and can be safely given to the safely given to pregnant patient. And these are other drugs that can be given. Your isoniazid and ethambutol, if you can still remember, these are medications or anti-COX, no, anti-TB. Ibig sabihin, once the patient is pregnant and she has pulmonary tuberculosis, you can still give patients with antibiotic therapy in the form of your isoniazid and ethambutol. Okay, so these are the drugs or antibiotics that can be safely given to pregnant patient. What are now the antibiotics that should be avoided? No, ito naman yon. Okay, these are the following antibiotic medications that we usually or should be avoided during pregnancy. First is your chloramphenicol. No, chloramphenicol, this is an antibiotic use, and if, for example, accidentally, although chloramphenicol is not anymore used nowadays, okay, marami na kasing antibiotic na pwedeng alternative, no? Alternative to chloramphenicol. But just in case the patient was given and she's pregnant, no? What happens is there will be gray baby syndrome as what they call it, no? Kasi the fetus can have or the baby can have cyanosis or vascular collapse or sometimes even death, no? So that can happen. But then again, chloramphenicol is not anymore used because there are other alternatives that we can give to the pregnant patient. Okay. So other antimicrobial, you have the nitrofurantoin. No? Although nitrofurantoin increases the risk for cleft lip. Okay. Sulfonamides, this is usually combined with trimethoprim used to treat methicillin-resistant Staphylococcus aureus. Okay. May be associated with first trimester if suitable alternative is lacking. But your sulfonamides and nitrofurantoin, there is actually a certain trimester in the pregnancy wherein you can safely give these two. Okay. But contraindicated in your sulfonamides is contraindicated in women with G6PD deficiency. Next is your tetracycline. Tetracycline naman, yellowish discoloration of the deciduous tip when used after 25 weeks. Okay, so those are the different structural malformation that happens just in case the pregnant patient ingested this antimicrobial. Next are antiviral agents. Okay, so antiviral agent, one of the studied antiviral agent that can cause abnormalities is your ribavirin. Okay, this can cause birth defects. So women should, with regards to ribavirin, you use 2 forms of contraception in monthly pregnancy tests while on therapy. So while they are given ribavirin, they are not allowed to get pregnant because again, getting pregnant while taking in this ribavirin can have or can actually cause abnormalities or structural birth defect. Kaya ang nakalagay dyan, delayed childbearing 6 months following drug discontinuation. So you have up until 6 months, no? Nag-stop ka ngayon, 6 months pa bago ka allowed na pregnant, magbuntis. Simply because some of the remnants of this antiviral agent can still be around the system of that mother, and still, even if she is not anymore actively taking the medication, that small quantity of a drug inside the body can still cause structural abnormalities. Okay. Next is anti-neoplastic drugs. When you say anti-neoplastic drugs, these are actually the chemotherapeutic agents. So all of the chemotherapeutic agent actually belongs to those medications that can cause structural abnormalities. Okay. So one common example is the cyclophosphamide. No? Cyclophosphamide, this is an alkylating agent. The malformations that you can see in a patient exposed to cyclophosphamide are skeletal abnormalities, limb defect, cleft palate, and eye abnormalities. Okay? So patients also delivered with in utero. When you say in utero na exposure, no? In utero exposure can have growth abnormalities and developmental delay. Other anti-neoplastic agents that are commonly used are methotrexate. No? This is an example of a folic acid antagonist. Okay? So we have the fetal methotrexate aminopterin syndrome that is characterized as craniosynostosis with clover leaf skull, wide nasal bridge, low set ears, micronactia, and limb abnormalities. Okay. Tamoxifen is a drug that is used for patients who has breast cancer. No, these are adjuvant chemotherapy. After the chemo IV therapy, nagbibigay pa sila ng tamoxifen. So the most common malformations are usually similar to those who are exposed to diethyl stilbestrol exposure. And one common abnormality that is seen in tamoxifen is your ambiguous genitalia. Next is your trastuzumab. Okay. So these are recombinant monoclonal antibody directed to human epidermal growth factor receptor 2 used to treat breast cancer and gastric cancer. No. So what happens to patients exposed with this anti-neoplastic drug? The fetus can develop oligohydramnios, anhydramnios, and renal failure. Okay. So these are examples of the malformations caused by your anti-neoplastic drugs. Okay. So this was already discussed a while ago that methotrexate is a folic acid antagonist and a potent teratogen used as chemotherapy and sometimes used as immunosuppressive drug for an autoimmune disease. Okay. So next is immunosuppressant, your corticosteroids or glucocorticoids. This is used to treat serious disorders such as asthma or autoimmune disease. But amongst the different steroids, it's the corticosteroids that are actually being used for pregnant patient, which belongs to the category B. Because sometimes patients has asthma, binibigyan natin sila ng steroids. Pero the usual steroids that we usually give is only yung pinakamababa lang, the hydrocortisone. Okay? If just in case the patient needs an IV steroids, hydrocortisone lang yung ginagamit. Okay? Another immunosuppressant is your mycophenolate mofetil. Okay? This is an inosine monophosphate dehydrogenase inhibitor used to prevent rejection of during organ transplant. Okay? So this mycophenolate mofetil, the abnormalities that the fetus can have is actually this picture, no? Example, you have microchia, auditory canal atresia, the patient can have cleft, coloboma, short fingers, and hypoplastic nails, and even cardiac defect. Okay. Next medication that is said to be teratogenic is your psychiatric medication. Okay. So psychiatric medication or patients who had psychiatric disorders, they are given lithium, and this is used for manic depressive illness. No? So what can be the structural abnormalities? Usually cardiac, abstain anomaly as what we call it, the cardiac abnormality that can be seen in fetus with in utero exposure with lithium. Okay. So first trimester exposure, the fetus can have abstain abnormality, but exposure in your delivery, neonatal lithium toxicity as what they call it. The patient can have cardiac arrhythmia, hypoglycemia, nephrogenic diabetes insipidus, floppy infant syndrome. Floppy infant syndrome is for lithium toxicity or lithium exposure. They become hypotonia with respiratory distress. This is actually after delivery. Patient can also have episodes of apnea or bradycardia, cyanosis, and feeding difficulties. That's why, just in case the patient is given lithium and she's pregnant, it should be discontinued 2 to 3 days prior to delivery so that this floppy infant syndrome will be prevented. Okay. Another is your SSRIs. This causes cardiovascular abnormalities. Omphalocele, when you say omphalocele, this is a genetic defect in the abdominal cavity. Parang nakalabas yung mga bituka ng baby. Okay? Craniosynostosis and anencephaly. So, between your paroxetine and your fluoxetine as SSRI, This is actually not considered as major teratogen except for the first, the paroxetine. No, this is the one that can cause the cardiac abnormalities, particularly an atrial or ventricular septal defect. Okay? So neonatal effects, these are the following. It was already mentioned a while ago. Next teratogenic drug is your retinoids. No, retinoids, if you're talking about retinoids, we're talking about vitamin A derivatives. Okay, the most embryotoxic or phytotoxic is actually the retinoic acid. Okay, so these are the vitamin A derivatives that actually inhibits the neural crest migration during embryogenesis. And if you can uh, still remember, your retinoids or your vitamin A are actually used as cosmetic agent. Ito ingredients of cosmetic agents. That's why some of the patients prior to pregnancy na ang daming mga nilalagay sa mukha, you have to ask them. Kasi baka mamaya, they are not familiar that the yung mga pinapahid nila sa mukha or the cosmetic agents that they are using has retinoic acid, and that is actually phytotoxic, even some topicals, no? Next is androgen. Okay, so androgen examples are your testosterone and your anabolic steroids. Now, what happens is there can be virilization in female fetus, resulting to labioscrotal fusion after the first trimester exposure and phallic enlargement. Okay, so androgenic progestins, example of androgens, ito yung mga Provira, okay, or medroxyprogesterone acetate, no? So what happens in a patient given with Provira, pero wag kayong matakot kasi sometimes, tawag nito, patients who have abnormal uterine bleeding are given Provira. Baka kasi matakot kayo just in case you will be asked to take it. If you're not getting pregnant early, or if you're not wanting any pregnancy, then you can safely use the medication. But just in case that patient got pregnant and she's taking Provira, no, not at all times naman, but just in case that can happen, structural abnormalities that is related to that medroxyprogesterone acetate intake is the virilization of female fetus or slight increase in the risk of cardiac defect. Another androgen that is currently available in the market is your danazol, no? Weak androgen that may cause female fetus virilization. So when you're talking about androgen exposure during pregnancy, the effect is usually virilization. Okay? So talking about hormones, no, depending on the exposure, when it happens, when you're talking about exposure to steroids, like if the patient was exposed prior to 7 weeks, then nothing can happen. But more than 7 weeks, then full masculinization of female fetus can happen at that time. And then 13 to 20 weeks, partial effects of genital ambiguity. So this is an example of a picture. No? Mukha siyang lalaki pero actually babae siya. More likely, this is exposed during, or the fetus is exposed in utero sa androgen. So you have akala mo siya penis, but actually this is clitoromegaly. Malaking clitoris. Okay? Tapos nagiging parang phallus na siya. So it appears as if may pututoy yung pasyente. Okay? Next drug is your diethylstilbestrol. Okay? So in your diethylstilbestrol, although this is not anymore available in the market, but before, exposure to diethylstilbestrol causes vaginal clear cell carcinoma in the fetus. Okay? So aside from that, exposure to this can also result to different Mullerian abnormalities. Now, so these are the different uterine abnormalities that can happen in a patient with DES-related exposure. Next medication, no? This is an anxiolytic sedative agent. This is the most notorious teratogen that was discovered. We call it thalidomide and analog. Okay, so what happens in the fetus that is exposed is it can have structural abnormalities, or we call it phocomelia. Ganyan yung itsura niya, no? Absence or underdeveloped of one or more long bones. No? This thalidomide before is actually used to treat erythema nodosum and multiple myeloma, if I'm not mistaken. Okay. But then again, this medication is already withdrawn in the market because this is the most notorious teratogen that was studied because again, it causes phocomelia. Okay, limb reduction. Ito yung mga common example. Okay, so these are the ones who are exposed in utero to your thalidomide. Okay. So another medication, methimazole, this is used for hyperthyroidism. Okay. So methimazole can actually cause embryopathy. We call it aplasia cutis. No? Patients can also have choanal atresia and esophageal atresia. Another medication used for the thyroid abnormality is your radioiodide. Definitely, this is contraindicated in pregnancy because of the following, no? Patient or the fetus exposed can have irreversible neonatal hypothyroidism. And you know for a fact that if the fetus develop neonatal hyperthyroidism, ang dami na niyan, di ba? May cretinism, pwede siyang mentally retarded, and then growth retarded, no? So this is a no-no during pregnancy, the radioiodide uptake. Okay? And even if, for example, you're not pregnant, just in case the patient had a medication or had treatment with radioiodide, they are actually asked to at least somehow delay pregnancy up to 12 months or after a year, no? A year after treatment. Because again, some of the radioiodine is still inside the body. And even if the amount is mababa na, that can still cause abnormalities dun sa future developing fetus. So, 1 year after treatment, you have to delay pregnancy. Okay. Next medication is warfarin. What can you remember about warfarin? This is a vitamin K antagonist used as an anticoagulant. Okay. But then again, even if this is an anticoagulant lang na ginagamit, this can actually readily crosses the placenta. And it can cause embryopathy if it was taken between 6 to 9 weeks. Okay. So this is an example of a patient with warfarin embryopathy. No, we call it fetal warfarin syndrome. The patient has nasal hypoplasia, sleep vertebral and femoral epiphysis. Okay, so this is how it looks like. So defect usually results from hemorrhage, disharmonic growth, and deformation from scarring in many organs. Okay. So there can be also dorsal midline CNS dysplasia, microphthalmia, optic atrophy, blindness, and developmental delay and mental retardation. Okay. Next is your tobacco. No? So this is the leading preventable cause of perinatal mortality. Why preventable? Kasi pwede mo naman siyang stop. Although some of the pregnant women cannot actually stop smoking during pregnancy. May mga patient kaming na-encounter na ganyan. Okay? So, again, tobacco can cause fetotoxic effect. Okay? So, these are the contents of the tobacco, no? That are actually, or that can actually cause structural abnormalities in the fetus. Number 1 is your nicotine. Okay? So, the most common that is documented with regards to smoking or tobacco use is the fetal growth restriction. Simply because what nicotine does is it tries to decrease the caliber of the vessels in the feto-maternal circulation. So, it will end up, or the fetus will end up to have growth restriction or restricted yung fetus, maliit. Okay? This is marijuana, no? Cannabis, no? This is a recreational drug that is said to be that can be taken by pregnant patient kasi meron talaga nagre-recreational drug even they are already pregnant. Although taking in cannabis, walang structural abnormalities. What happens is hindi siya structural but more of the psychological, not the psychological, the mental development of the baby, no? And it can also decrease yung attention span and visual motor coordination. No? Wala namang structural abnormalities like the other medications, but taking in cannabis during pregnancy, more of the brain development. That's why patients or fetus exposed to cannabis in utero, they have decreased attention span and visual motor coordination. Okay? How about herbal remedies? Remedies and its teratogenic exposure. Actually, some of the patients kasi will ask you, Doktora, may herbal po silang pinapainom sa akin. Okay ba? These herbal medications are actually not regulated. Most of them are not regulated by the FDA. So, as much as possible, you try to tell them not to use these herbal medications during pregnancy because yung studies, since this is not FDA regulated pa, the studies for pregnancy medyo mababa pa. So, it would be safer not to use it. Okay? Other recreational drugs, amphetamine or shabu in Tagalog, no? These are sympathomimetic associated with symmetrical growth restriction and minor congenital abnormalities. Okay? Another recreational drug, actually amphetamine, this is the most common that happens, the placental abruption and preterm and stillbirth. So whenever a patient is hypertensive and she's taking, whenever a patient is taking in amphetamine, she's pregnant and she has hypertensive complications, no? This can happen. Okay. So another recreational drug is your cocaine, no? Although cocaine di naman masyado marami sa atin. In the United States, yan ang meron sila. Ang meron sa atin kasi the amphetamine and the cannabis, right? But with regards to cocaine, this is also what happens to that pregnant patient, same as with the amphetamine, vasoconstrictive and hypertensive effect. That's why when you say placental abruption, premature separation of the placenta, this can happen just in case there is uncontrolled hypertension. So same with the amphetamine, okay? So aside from those, this can happen sa mommy, okay? Kasi sa fetus, more of developmental delays and growth restriction also. Okay? Yeah. So other abnormalities secondary to cocaine, aside from the developmental delay, some can have cutis aplasia, porosencephaly, although this rarely happen. Okay? But again, some of the structural abnormalities can still be seen in patients or in pregnant patients using cocaine or in fetus who is exposed in utero in this recreational drug. Another recreational drug that is used is your opioids. Okay. So opioids or your heroin, actually this is not considered to be a major teratogen. But what happens is, nagkakaroon ng risk for preterm birth, placental abruption, just like your not the cannabis, the amphetamine and the cocaine, and fetal growth restriction. Okay? So in your opiates, what is the most glaring is the neonatal abstinence syndrome. What happens is there will be neonatal narcotic withdrawal characterized by central nervous system irritability that may progress to seizures if untreated, along with the kypnia episode and episode of apnea. So this is actually seen post delivery na. Okay, nung pagkapanganak na after delivery. We call it neonatal abstinence syndrome, and this is associated with mothers using heroin or opioids. Okay? So these are some of the, just in case there will be abnormalities, this can happen, or these are some of the pictures of fetus affected by mothers using recreational drug. Although this rarely happen. Ang most common is the hypertension with that of the cocaine and the amphetamine and the abruptio placenta. But structural abnormalities, hindi masyado. Okay? So these are actually my last slide, no? So when you're talking about teratology, I just emphasize the drugs and the particular abnormalities that can happen to the, or structural abnormalities that can happen in the fetus. Please do study the different classifications or categories of the FDA category of the drugs, because that can be asked to you during your examination. para i-identify nyo. Kunyari, binigyan kayo ng antibiotic, anong category yun? Or for example, binigyan kayo ng certain drugs, you can be asked, what category does that belong? Okay? Are there any question before we end our topic? Question? So if there are no question, we'll see each other. I don't know if I can see some of you in the OPD lecture at 11 to 12 o'clock. Okay. So that ends our teratology lecture for this morning. Thank you for listening.
Thank you, Doc. Thank you po, Doc.